When I came out and said in my community that I'm a bereavement doula, I had a lady contact me inbox and she said to me, I wish I knew you 4 years ago. You would have been so helpful to me. October is PAIL month. What does PAIL mean? Hello, welcome again to my channel. My name is Naomi Karemi Aingu. I am a birth, postpartum, and bereavement doula based in the Leiden area. Today, I want to talk about PAIL, the pregnancy and infant loss. There's also a bit of controversy with where the line comes in from some people. Some people think that sharing a picture of your child who has passed on is a thing. But I'm going to share with you a few reasons, maybe to help you think differently. The difference between a miscarriage and a stillbirth is that miscarriages happen before the 20-week mark, and stillbirths happen after the 20-week mark. And there's also another one that I will add on as I'm continuing to speak. The 1 in 4 statement is for miscarriages because they estimate that there is 1 in every 4 pregnancies that end up in miscarriages. The 1 in 160 births are stillborn. Because I see a lot of moms who have gone on to lose in support groups who actually say this is something that I wished they talked about in my prenatal class, and they don't. That is because to a certain degree, death is still looked upon as something that is frightful, and it is taboo amongst communities to still hush about it. These photographs that are made from Now You Lay Me Down, for example, they're more for memory and for a lot of people to find closure and a place to put grief. You need, or they need, these pictures to actually acknowledge that yes, they did exist. Yes, I saw my child, and yes, he wasn't alive. Now, if somebody actually comments on something that is so heartbreaking like that, and actually ask with a judgmental attitude why somebody would even want to show a baby in that way to the world. If I put an answer back to you, I hope it makes you think. Yeah. If that was your child in your arms who is lifeless, believe me, you will look at them with a different eye. And because that baby is yours, and you had every hope of bringing that baby home, and you had all the dreams set aside for how that child was going to grow up, how that child was going to do X, Y, Z, it is every mother's wish to show the families what they're going to miss of that baby. Because connections are made from the moment you see that extra dotted line or the line on the test strip. Parents don't plan a future when the baby is born and if that baby makes it home. Parents plan a future from the moment they test positive, and they already think about what their life is going to change like, and how this little one who is coming is going to impact them. One person that I know asked me, is it sorry for your loss or is it congratulations for the birth of your baby? It's actually congratulations for the birth of your baby, because even though they have come in a different way, they have still given birth. That was a birth for that woman. That was a birth for that couple. That is how they go hand in hand. As a bereavement doula, I get invited sometimes to hold places in spaces that cannot even be held. The most heart-wrenching spaces that you walk in and you leave that place and you think to yourself, goodness me, I thought I had it so bad. It's not something to take lightly. Nobody should have or feel the right to judge and measure anybody else's grief, because people grieve differently. So when I'm invited to these places, I like to bring something that is meaningful that I made myself. I started crocheting these baby bassinets. I now call them the Maria Gabriela bassinets, from a birth that I attended as a bereavement doula to a beautiful little baby. So I remember arriving there and the whole room was quiet and I had no gift to give this mom, but I had made her something according to the conversation and the meetings that we had had before to prepare them. This is the bassinet. Now, these bassinets, they're actually used to bury the babies in, because under 20 weeks, there's not many things that will fit them at that age. And with the Maria Gabriela bassinet comes a whole set. So in this bassinet is a little burial suit that I designed from a pattern that I found online. So I'll make a blue one or a pink one, something that will fit them for their send-off. And with that, I started crocheting keepsake. This is something the mom can keep, or it can go with baby, or she can keep the heart with it. And with that comes a little blanket. It looks like that. That is normally laid in the bed. And there's a little baby soap, which is this one, because it's a complete kit. So I would normally just make a whole bassinet with everything and I hand them over like that. I think it's a nice way that they can look at their child in something that looks much decent than them wrapped in paper. Now I'm going to touch on a few things that you shouldn't say when you're with a parent or parents who are grieving, especially in the immediate, but also never, okay? There is a sentence that is normally used with a lot of people, whether it's knowing or it's not knowing, unaware, but it's just a line that doesn't resonate with what that parent or with the situation that's going on in the family. A statement like, but they are in a better place. They are in a better place is not something that you say to a parent who is grieving the loss of their child. They are in a better place is not something that you say to anybody who has lost a loved one. Point. Because no child is better in the grave than with their parent. We accept it's a rite of passage, but they are not in a better place being in the grave. Another one is, yeah, but you already have 2 or 3, so you can be grateful of having those other 2. Every child is a gift to a family. And some of these children are wanted. They're absolutely prayed for and wanted, and they just don't make it. It doesn't validate their loss. It does not validate their heart, their pain at that particular moment. And if I can give a tip, sometimes just be present. Just your presence is enough without you saying anything. And if you do avail yourself, try as much as possible not to comment on something that you're not sure of. If you are not sure, do not say it. So sometimes just your presence is enough for a parent who is grieving. It's the most isolating moment, and it's the most terrible thing that could happen to any parent. So adding obnoxious comments on top of that is really heartless. As humans, and when we think of humanity, we need to do better and look after each other. And I think the moment we stop tiptoeing around death with mothers who have suffered a miscarriage or a stillborn or an infant loss, it is the moment that these women will start to heal, because we are normalizing it. Because right now, there's a lot of tiptoeing, and always call those babies by their names. If they were given a name, if they were known as Amanda, call her that. That was her name. Validate her existence. It brings a bit of comfort to a mother who has lost, to know that those around her actually acknowledge that she had a pregnancy, that she had a baby, and that that baby did not live. You can't say to a mother who just lost a child, you didn't play with her. So why are you crying for so long? 6, 7 months, you're still mourning this child. Until you have experienced it, refrain from using comments that are more hurtful than helpful in a situation that is so fragile and painful. When I came out as a bereavement doula, I had a lady contact me inbox, and she said to me, I wish I knew you 4 years ago. You would have been so helpful to me. And I asked her, why was that? And she said, I went into the hospital to be checked because I had less fetal movements. And when I arrived, everybody else was helpful. I was attached to a CTG machine, nurses coming in and out, conversation was normal. Until that baby's heart stopped. Then everything around her was weird, because people were sneaking in. Oh, just in case we don't. Oh, be careful, just in case we. I'll repeat what she said. She said, suddenly, nobody knew how to support a woman with a dead baby. I felt very alone and abandoned. It's a heavy topic, but it's a topic that needs to be heard. So yeah, my course will be ready in a few weeks. I will post about it on my website. If you check my website regularly or you follow me on Instagram, you will see. I will do an online webinar about it, an online workshop actually about it. And I'll touch on a few of these things in a more broader explanation, and how we can support. And if you are a brave parent and I'm talking to you and you're watching my channel, I sympathize with you. I know the pinch. I know the pain of losing a child. But you're not alone. You can always reach out to people. Reach out to me. Reach out to somebody who can support you. I hope I leave you with something that you can think about. And I hope I leave you with some wisdom that you can use when you walk into these very fragile spaces. That you can leave somebody feeling supported and held in your presence, even when you do not say a word. Thank you very much. And if there is any other topic you would like me to cover, please comment in the comments below. And otherwise, take care. And until next time, bye.